Hello, everybody. I'm Martin Yades, and I'm back with Dr. Florian Kongoli. Hello, Dr. Florian. You are in
Hello,
Osaka.
hello, hello.
So,
I am here. I am now at the heart of the clinic, image guided therapy clinic, with the
uh-huh.
inventor. Actually, I can say the inventor, the doctor, the scientist. He has done everything here, and there cannot be a better case of artist science here. Science first and medicine after. Vice versa, we never know. But I think it's science first and medicine after. This is Dr. Hori, the inventor of a revolutionary technique that we explained a little bit earlier. And, you know, during his intervention, it's not a surgery, it's non-destructive surgery, non-invasive surgery. We're going to explain all how it works. But the doctor is here. He's preparing to start the intervention. And he's saying a few words before he starts, and then we're going to follow.
Very good.
Thank you. Thank you for your excellent introduction for me.
Well, you deserve it.
Yes, now I'm studying the interventional oncology. She has the primary breast cancer, and she suffering from the recurrent tumors for a couple of years. Then we want to insert a catheter up to the right breast and try to infuse just small amount of anti-cancer drugs. And then after, I'll do the embolization to keep the anti-cancer drug stay inside of the tumors. So this procedure is very, very non-invasive therapy. She's awake and it takes only 1.5 hours to complete all procedures. And she will not have any pain or something like that. So I'm gonna start. And I'll do at first I puncture the artery of the femoral artery. Then after we insert a catheter into the aorta. Okay, I'm
Excellent.
starting.
Excellent.
So he's going to start, and then we're going to follow. Thank you, doctor.
Very good. It's a great pleasure. Let me just tell our audience how it's going to work. First, it's a big pleasure to have everybody
Sure.
with us. We have
So
two cameras in Osaka. Dr. Florian is talking to me with this camera. And we have a
yeah,
third camera also that is linked in the screens where we are going to watch what is going on
the
in the
screen
procedure. Yes. Yes, Dr. Florian?
Use this camera to take Dr. Hori's
is
intervention
better.
and
Yeah,
yeah,
better.
and we can use this camera to take
Sure,
the image.
because this is static. So Cecilia has a very good suggestion. We can put the
Yes.
same camera, the second camera inside to show the Dr. Hori during real operation.
Excellent.
And then
Excellent.
here, this one we can show once in a while how a catheter
Excellent.
proceeds.
Perfect. Perfect, Dr. Florian.
Let's do it.
This is even better than what we've planned.
Correct. So I follow you,
So
Cecilia.
you can,
Okay.
Dr.
So
Florian, I will just remind you that probably you have to be careful because you don't have that protection that
No, I need the protection. I need the protection that you, Cecilia.
yeah, there.
Okay.
There, just
Okay.
カメラを生成の手の動きを撮りたいからどこにいてくれたらいいかな。
this probably it's this one video of a kind in the world, huh, Dr. Florian?
In the world. This is a video of the world. The procedure is one in the world. And the video live. is one
Nobody
in the world.
has ever filmed this live before, so
No, nobody. No, sir. Nobody.
and you were mentioning with Cecilia that everything you see there was invented by him, right?
Camera because we have a lot of machines and consider about it. Right.
So here we are going to determine where the camera should be put. And then we're going to go over the patient without names for sure to protect the confidentiality. So here we are. This is a revolutionary technique being broadcast.
I don't think you can take off the mask, Dr. Florian.
Sorry,
You cannot take off the mask, Dr.
I
Florian.
know, but I have to drink some.
Yeah, but you're in the middle of, you're in a sterile
It's not.
environment.
No, it is not. It's not. It's not a surgery. You heard the doctor. He just punched a hole in the ephemeris and put the catheter. That's all. The patient is
Okay.
awake. He mentioned it's nothing.
Okay.
So the whole procedure is putting the catheter until to the tumor, and that's it. You know, there is none. There is no. I'm going to change this.
Yeah.
You know,
It's
so small. This way. This way.
yeah.
So
Looks like a
so
life vest.
again,
Is this for radiation?
I do not know. It's for radiation. This is heavy because of
Protection for the radiation.
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 But there is radiation there.
No, there's a light here. If the light's on and there's radiation, so you can just.
Oh, okay.
Yeah, but this touching is.
It's okay. It's okay. Good. Actually, I like. No problem.
Yeah, you look
It
good.
makes more original.
Yeah.
So
You look like
but this is
an
not a.
FBI agent with a.
So this is not a real sterile environment, correct?
Mhm.
It's not 100% sterile. You don't need to be sterile. You know, to be sterile environment.
I prefer to speak with you, and he just in this protector, and then he leaves everything inside. So,
Okay. So we're gonna put the camera where exactly?
yeah. That's part of the procedure.
Okay. You can put it in the corner there. The corner.
Yeah, that's not a good line.
In the corner here.
Or just there's a space there.
Yeah.
No.
I would say.
Okay, I will go inside first.
Okay, sure. You follow the procedures, huh? We are determining where to put the second camera. Again, this is once, never happened before. Mario, are you there?
Yes.
So we are trying to do the best in order to broadcast something really interesting. And so, as you know, depending where you put the camera,
And by the way, Dr. Florian, Apple does not sponsor us, but they could. Yes, because we're showing iPhone.
Dr. Kongoli.
correct? Yes.
Yeah, we can just put it.
Yes. Just a moment, Mario.
我们刚才有拍那个。
So, Mario, this is the front camera.
Yes, I think it's good.
It's really higher.
Mm-hmm. Very good, Dr. Florian.
A little bit closer. Yeah. Yeah.
Is it better here, Mario?
Yeah, I think it's good enough. If you could lower the camera a little bit.
Sorry, what are you doing?
Yeah, perfect.
Here?
Yes, very good. We cannot see details because it's not focused in the area he is, but I think if you sorry,
show full screen. That's perfect.
like this. What do you think?
That's perfect. That's perfect.
Yeah.
It's okay?
Yes, it's good.
Okay. Good. Okay. So we can start.
Yes, go ahead.
Okay. So, well, this is the catheter.
I don't think we can. Oh, there we can see. Yes, it's very thin. Huh?
So he's putting the catheter now. This is the first stage of the procedure. It's a very
Okay.
important part. This is the invention. Without this, you cannot do anything. And this is Dr. Hori has invented this. And he is following in the screen. Now, you see there.
Yeah, he says everything. It's like a video game, right? Basically.
Correct. So the image guides Dr. Hori to put the catheter. Yeah, Mario, in the
Yes.
first camera, you should show. Yeah, here, this one. Do you see the catheter?
Yes.
This is Mario.
Yes.
Okay. So this is the real procedures of Dr. Hori's hand, putting the catheter, and he is guided. He is guided. Here, you see the catheter?
Well, not exactly. Is it in the lower left?
It's in the, no, it is in the here.
Ah, okay, in the lower center.
Yes. Here,
Yeah, okay, I can
this is
see it.
the full screen, and then you see this is the small being moving.
Yeah.
Now put in the first camera, put the screen
This
here.
one.
So the image is guided Dr. Hori to put the catheter.
And he has to do it very slowly, yeah?
Very slowly here. You see the small tube? It looks
Yeah,
like a tube
yeah.
moving. This is exactly what he's doing. And he is the real hands doing that. And as you see, he is concentrated on the screen. The screen guides him.
Incredible. It's amazing.
This is revolutionary. So I'm going to show again the catheter.
This image is gotten by CAT scan. That's it.
No. The not
camera.
CAT scan. This is real. This is real. Yeah, exactly. CAT scan.
Okay.
I have to get the details, but exactly like that. This is real time. You see where the catheter it is. Real time.
Is this considered nanotechnology, doctor?
No, I don't think it's nanotechnology, but you can use nanotechnology to improve it.
Let's see. So as you said, a lot of sensors, a lot of things. This is pure science. Huh? This is
Pure
art.
science.
This is pure art.
Science. So this is the Dr. Hori's hand. Now show the first.
No, but just to have an idea of him working, he looks at the camera in there.
Now, in the first camera you show exactly.
Yeah.
Give this one here. So you see, he is guided. He is guided electronically. This is science at the service of medicine. Everything is electronic, and everything is invented by him personally.
Now this is incredible because you need a lot of knowledge of electronics, of physics, of chemistry.
Do you see the catheter being moved?
Yes, it's incredible. It's incredible. And the most incredible thing that it's so micro
It takes
small.
time
You know what I mean?
because,
Just a moment, Mario. Let the doctor speak.
yes, this is very difficult type of the artery because she had the elongation of the artery because of the arteriosclerosis. So it takes time, but
So again, Mario, he is explaining that so each patient is different, and the patient had some. We're going to go to the characteristic of the patient without name for sure,
Yes,
and this is a critical part because the arteria is kind of it's kind of difficult to deal with. and
probably
take
she
some
has a
time.
kind of blockage in the artery.
Yes.
That's-
And again, we are speaking for a breast cancer patient, primary one.
now I'm studying artery. No, I'm sorry.
incredible. For example, Dr. Florian,
Do you see
I
the catheter
myself,
here?
I have a clogging in the arteries because I use 3 stents. Probably this would be something that would make it difficult in a situation like this, probably.
Well, but you don't have you probably, but it depends because you don't go near the heart. You go near the where the tumor is.
Yeah, but I'm just giving an example because what did he say? I didn't hear.
Oh, no, he's speaking Japanese with the patient. The patient is awake. This is the
Oh,
beauty
the
of it.
patient is awake.
Yes, no, the patient is awake, and there is
Incredible.
there is no
No anesthesia,
no
anesthetic.
anesthesia.
Local.
Local
Oh, come on.
anesthesia only for puncture because where the place where he starts the cataract. That's all. The patient is awake. It's amazing technology.
No, it is amazing because all this, and he's alone. He's doing all the procedure by
He is
himself.
doing alone because this is the first part of the procedure because this is the where he is the king of this procedure. He is because he's the only one doing that. He's invented it. He's the only one doing that. 45 years of
But I
experience.
mean, he has
doing
no
this.
nurse, no
No, you don't need. It's not anymore.
assistant.
It's not a surgery. It's not a surgery. Forget the
Wow,
whole
I'm
thing. It is
impressed.
the whole thing. It is to include the cataract and to bring it to the tumor. And this is the specialist on that. Look how many nurses you have. How many screens? Each screen is a nurse. Is a nurse.
Yeah, incredible, incredible.
So basically, the nurses are replaced by each window in the big screen.
Yeah,
Just
probably
figuratively.
for sure.
Figuratively. But this is what it is. You don't need. It's not a surgery.
And I mean, Dr. Florian, this is such an evolution because imagine cancer, as she said, you usually have 3 different treatments. One
Yes.
is chemotherapy, the other is radiology therapy or surgery, and all of them are very aggressive. And this way, you get the best out of chemotherapy, for example, without the side effects, as you mentioned,
Exactly.
because you're injecting the
Chemotherapy locally. only at the
chemotherapy
tumor.
specifically directly on the tumor, so it acts
Exactly.
much more concentrate in a much more concentrated way, right?
Correct. This is the beauty of it.
Wow, look at that in
Because
his hand.
specificity, this is
And the
Guide
guiding wire. Guiding wire. Another.
guiding wire. Guiding wire.
Guiding wires.
It's a guiding
Wow.
wire for the cataract, correct?
Yeah.
Okay.
Wow, this is incredible. And
But-
Dr. Florian, I remember
That's
that
incredible
in the
is
last
one thing.
Sips of
Just to
Science,
interrupt. Now, this is This is the catheter. Look at the catheter.
No, this is the microguide wire. The diameter is 0.1 millimeter. Point
How many?
0.7.
No.
0.5.
0.5. So the diameter is 0.5, correct? Millimeters.
Half millimeter.
Yes, half a millimeter, correct.
Wow. Wow, this is amazing. This is surely amazing.
So this
Now,
is,
Dr.
this
Florian.
has changed the concept of the entire operation room. Everything is changed the whole thing.
And not only the operation.
The guide wire.
This is the guiding wire that the doctor is using right now. It is
Wow.
you see its diameter is 0.36 millimeter.
Wow.
0.36 millimeter.
1/3, not half, 1/3 of a
No,
millimeter.
one third, correct.
I said half. Half was small for me already.
No,
1/3
the
is even smaller.
33 again, we can show, and this is
the micro catheter.
micro,
Catheter.
when it is used for micro catheter. Okay. This is the catheter, the famous catheter, micro catheter. So here the
Artery.
sorry again.
Catheter is in the target artery, internal mammalian artery. And now it's
So now the catheter it is in the breast,
yes, in the artery to the breast.
in the artery of the breast.
In the artery of the
You're
breast
following?
already.
So the doctor just said that the catheter reached the artery of the breast.
I
And there
see.
is a little bit longer to go to the breast.
Yes. Then this is the so-called internal mammalian artery. So we'll take the angiography.
What is
We
he
can
doing now,
see-
Dr. Florian?
So now the catheter is going.
Now you can see two circles, and
Ah.
there is a marker being the tumors. So the upper circle is the upper end of the tumor, and the lower circle is the lower end of the tumor.
So the tumor is the upper
Just
side
between the two coins.
between the two coins.
Yes.
So the tumor it is the black dot.
The black dots. Yeah,
It is
okay.
possible to see the tumor, the angiography, but from now we will take the angiography and then we will verify the anatomy of the artery. So I'll do the angiography from now. Okay, それでは1コンマ0
So now we are doing to understand you are doing what?
doing the angiography.
Angiography, which serves for
We want to know the arterial anatomy. We have to recognize where we have to go.
okay. And this is using the catheter to do that?
Yes.
Okay.
Then we'll see a very right.
So this will show the nature of the tumor, correct?
Yes. Yes.
Okay. So now the other part is that there are some questions people are asking. Is there any type of cancer that cannot be treated by this? Some people asking.
1.0の5。ここでいい？もう見た。Okay. Oh, that's good.
So now they are doing an angio with the purpose of
Angio what?
what is called angio.
Yes.
Okay.
You can see the internal. This is the main feeder to the tumor.
Oh,
Then
and the tumor,
yeah.
the tumor. Let you explain for the people that are not medical.
Yes.
So the tumor, this one, correct?
Yes.
The dark side.
Yes. This one is tumor.
This is a tumor.
Yes. But it is not uncertain. Then you take the CT scan from
Correct. Correct.
and then you can imagine how is the tumor and how is the size of the tumor. So
Correct.
from now we take the CT scan from here.
And the CT scan is a contrast enhanced CT scan or IV or IV.
The contrast is injected from the specific arteries
Okay.
to the breast cancer. Then we can recognize.
Sorry.
So the catheter is here.
Uh-huh.
From here we will inject the small dose of the contrast.
So this is the catheter.
Yes.
And where is the end of the catheter?
End of the catheter
It's here. Correct.
And this is the internal mammary.
And he's injecting substances now.
No, not now. Just a moment. Let me understand, Mario, and I'll explain. But you can hear also Dr. Hori.
Yeah. I hear the if you can speak a little bit louder because this is the internal thoracic artery coming down to the chest wall, and from here you can see the small branch rising from here.
Uh-huh.
Then it goes down to the
tumor
area, and tumor is here.
Uh-huh.
But we are not so confident
Uh-huh.
that we will take the CT scan from here, injecting that
Correct. The contrast.
Then we can imagine how is the size of the tumor and how is the nature of the tumor. So we will take the CT scan from.
And this will help us to understand where to put the catheter.
Yes.
Exactly. So until now, the catheter is here, and the CT scan will tell us to continue up to here or here or here. Correct?
And if necessary, we are going to set the catheter to here. But probably there may be some small branches arising from here. So it is also necessary to infuse. So anyway, we will take the CT scan and we will
Correct.
which position is best to treat.
To inject the chemotherapy.
Chemotherapy.
Okay. And chemotherapy is a standard one, or what type of chemotherapy you use? Because chemotherapy is just a generic word.
Yes, but the basically it is the usual anti-cancer drugs for the breast cancer.
Okay.
But the dose is
Very low because it's local.
so we don't need to care about the side effects and so on.
Correct.
Right.
Correct. So let's just explain a little bit more. He was very clear, but just to repeat how I understood it, and Cecilia can correct me. So but this is a real time, correct? This is a real time. But the image is taken by what technology? The image. This image.
Angel.
No, the image until now, before doing angio.
Before doing it,
This image, what technology is used? Is a CT.
angiography.
No,
Yeah.
are doing now. But before.
CT.
CT. Oh, this is angiography.
Yeah, this is angiography.
And the image is given by angiography.
Yes.
Okay.
And now they're going to do
The CT scan.
Yeah.
Yeah.
CT.
Correct.
Yeah.
Right. And you see, Mario, doctor is always there himself. See, even when doing a CT scan, it's amazing.
Yes.
Now, let me make a resume. Let me make a resume. Cecilia's going. So the black spot here. The black spot here, it is the tumor.
Yeah.
Okay.
The catheter has reached up to here. Okay. Now, there are many ways to put the catheter to the tumor, through these vessels or through this vessel. Did I understand correct?
Yes.
Okay. So there are many vessels that send you to the tumor. So in order to be sure of the nature of the tumor, they are doing a CT scan in order to understand the nature and what is the best place where the catheter should continue in
They're
order to
making
be
a
the
map,
most effective
treasury
possible.
map.
exactly trying to see. So because until now the catheter is here. Now there are many options going through here, going through here, going through here. So this will be determined by the CT scan. Is this my good understanding?
Yeah.
Now, Dr. Florian, ask
Yes.
Cecilia, please, because
Yes.
I understand that at a certain stage of the procedure, you're
Yeah.
going to kill
So they
the
do the CT.
Just he's asking a question.
you're going to kill the blood feeding of the tumor.
Yeah, that is the next stage. We are not there yet.
Okay, okay.
We are
But
now
then you
the
have to
first
reach
stage.
all the vessels.
No, not necessarily. The best one. What would be the most effective? That's why the CT scan right now.
I see.
Could be one or could be two.
Okay.
So we
Not
are at
all
the
of them.
stage, not well, not all of them. We're going to ask the doctor. So, but
Okay.
this Cecilia, I brought a book here. We're going to go there, please. This is very important. But just to explain, so we are at the first stage, putting the catheter. Catheter has the reach until here in the breast, and now here. Cecilia, can you explain, Cecilia?
This one. Wait,
So the catheter is going here, correct?
wait, yeah. This.
This part. Oh, this is the blood vessel.
Also the internal thoracic arteries, and now the part is putting his catheter inside
Of this artery,
this artery, and there are some small arteries also.
like this one.
Yeah.
So right now the catheter is up to here, correct?
Yeah, also the,
So the catheter is up to here.
yes, yeah, this artery.
Yes. And now we're going to decide which one to go through here, through here, through here. Correct?
Yeah, because a lot of blood supply from the artery, and Dr. Hori will find one by one and just do all the do the treatment.
Okay. So the question is that now we're going to find that is it necessary to put the catheter in? The CT scan will determine what is the best way to reach the tumor. Yes, we need only one direction, or we might need two directions.
The focus of the CT scan is to confirm the blood supply to the tumor.
Okay.
And we all the time we check the individual images.
Okay.
Then we'll try to find the best position to inject the anti-cancer drug.
Correct.
And
But this is it's only one position, not two positions.
it depends.
Depends.
Sometimes we have to insert a catheter 3 or 4 arteries. But sometimes it's okay to insert infuse from one artery. So it
Correct.
depends on the patient.
Correct. Depends on the patient. So it's art and science. So there's the CT scan will show this, correct?
Yes.
Okay.
That's exactly this, Dr. Florian. Art and science, because it's
Art and
almost
science,
a
exactly.
work of art.
But imagine all this, everything has been invented by Dr. Hori. So first he's a scientist and this doctor. And no, but this is unique
Leonardo
in the
da
world.
Vinci.
This is unique in the world.
Yeah.
So
Yeah, no.
he's looking at the CT scan results.
No, it's it's how to take the CT now. And we just give
Oh, okay.
they
Okay.
working as a team, so we discuss.
He's still evaluating the best approach, right, Dr. Florian?
Yes.
Okay.
They are no, they are evaluating. Doctor, you are evaluating what is the best area to scan, correct?
Yeah.
Yeah, they are evaluating what is the best area to do the CT scan. CT scan again, it is to determine the nature of the tumor, as I understood, and what is the best way to inject the chemotherapy. So before injecting the chemotherapy, you have to determine in which blood vessel you have to put the catheter. So this will be determined by CT scan, because of the nature of the tumor. It's always good to find the best position to inject it. So to find the best position, you have to put the catheter exactly there. Is this correct? So this is the CT scan will determine this, and
Very good.
they are locating, they are zooming in the area that gives the best information possible.
I see. Dr. Florian, I remember that one of these programs, you mentioned that everything.
So just a moment. Let's hear Dr. Hori.
Okay, we compare the two images. This is before the treatment. We took this image yesterday.
Okay.
Okay.
So if I can continue, because he'll take care for something. This is the image. They took it yesterday before the treatment, correct?
And what is this exactly?
This is the CT scan, correct?
Yeah, but of the tumor?
Where is the tumor here? Now I have to interpret it because it's not my specialty.
Yes. The 3rd, October 3rd.
This is October 3rd.
This is 12 today.
Okay. So, doctor, this is the before the treatment.
Yes.
And this shows where is the tumor here?
Tumor is
This one.
not just here.
This one.
This one. This big mass is the tumor.
Okay.
And almost 90% of the tumor is enhanced from this artery. Okay, here,
This one.
here you can see the 90% of the tumor was enhanced
Enhanced with a
from this point.
exactly because of the CT.
But look, the lateral part of the tumor is not enhanced. So then we have to try to find the artery coming down to this part of the tumor. So probably 90% of the tumor is covered from this artery. Then we are starting to infuse the anti-cancer drugs from this point.
You are starting to put in anti-cancer drugs. And this is done through, and by the way, you have invented yourself, what kind of anti-cancer drugs you're putting?
We try to use the anti-cancer drugs which will be effective for this patient.
So it depends on the
She has already had the long story of the treatment using the anti-cancer drugs.
okay.
And some of them are not so effective. And some of them could be very, very effective. So before starting the treatment, we investigate which anti-cancer drugs are best for the best patient.
Correct. So then now you are, Mario, we are in the stage that you are, so you are able to send the catheter at the right position. So the catheter, it is in the right position in the tumor.
Yes.
Now, Mario, this way, you hear me, Mario?
Yes, loud and clear.
So now we are the stage 2. Stage 2, injecting the anti-cancer drug with the so-called chemotherapy drug. And the doctor chooses the best from his experience for the type of cancer, correct?
Yes.
So now we are injecting that one. And how you inject it?
We use the
machine there, right?
No. Hand injection is much better.
Hand injection is much better.
Yeah, we are always very careful to avoid the backflow of the
Correct.
anti-cancer from
Correct.
target to artery.
Correct.
So we have to be very careful, and we have to observe the distribution of anti-cancer drugs during the procedures.
Correct. Do you understand?
Yes,
Mario?
yes, I do.
So it's clear. So this is much better hand injection than
It's
machine injection. Because they
amazing.
want to
He uses a
avoid
syringe,
overflow.
a normal syringe.
It's a syringe, normal syringe.
Normal syringe.
It's a normal syringe.
Interesting.
But
So much
besides of the
technology.
anti-cancer drug,
Just a moment, Mario.
besides of the anti-cancer drugs, we are trying to use some medicine to protect the normal skin. And sometimes, if we infuse the anti-cancer drugs, normal skin will react to redness of skin, pain of skin. So we have the technology of the degenerative therapy. And we have some substance to protect the skin.
Because sometimes skins become sensitive.
Yeah,
Skin outside skin in the breast.
Yeah, and it is very, very big point for her. So we always try to keep the patient skin very clean and breathing.
And this comes from your experience from the other therapy. The
We are investigating the regenerative therapy.
regenerative therapy.
Yes.
So you see, the different therapies help each other.
Yes.
You know,
I
because
see.
so
I see.
as a side effect, the small side effect compared to this with chemotherapy to put it in the body. It, there was I read it somewhere. The doctor they said that there if you use a lot of chemotherapy without end, body wise, every time change and change and change, there are two consequences: or the cancer will kill you, or the chemotherapies will kill you.
Yeah,
So
yeah,
this
it's
is a
very strong.
popular,
Very strong.
I know.
Yeah.
And it's not in this case. Chemotherapy is just locally in the tumor. It's
Concentrated in the tumor.
So
Where
the
it
side
needs to
effect
be,
is
right?
just so minimum in the skin, and they have the technology to avoid
Dr.
that.
Florian,
So this is night and day.
yeah, ask the
difference.
doctor about the immune system.
Yes.
Does it affect directly the
So
immune
I'm
system or not?
studying the infused
Okay,
anticatheter.
so should we come there? Can we come? Or no? It depends on you. It's better here. Okay.
Okay.
So
Whenever
this
you
is,
have a
I'm
chance,
gonna ask
ask
the
him
immune
about
system
the
after.
immune system.
There's nothing. I guess it affects zero the immune system, but we're gonna ask him.
Okay.
Just logically, I said it.
Now, one thing, Dr. Florian, that I remembered is that in another program, you were mentioning the importance of materials. This
Yeah.
has a big influence on materials too, right? Because you cannot have a catheter this
That's
thin
material.
if
That's
it weren't
material.
for the material.
Exactly. So I'm just repeating. Where can we see here the injection? Can we see Cecilia? Can we see the injection? How can we see the injection here, or is it possible to see the injection?
I think they're.
Oh, there. Okay, so there.
Still have a camera there, right?
Oh, yeah, yeah. Can I have a camera?
Yeah. And, you want to see the live, and we can just take the images here.
Yeah, let's go here. Let's go here. Let's go here. Let's go here.
Yeah.
So here
Yeah,
they're gonna put
we're showing the camera inside the
Yeah,
procedure
you have the
room.
camera there also.
There is a camera
There and also here.
Yeah. And we can,
That's the best combination.
Yeah.
So these are they're injecting manually the therapy. I mean the drug cancer fighting. We used to say chemotherapy, but it's not the real chemotherapy. It's a drug. It's a cancer fighting drug, liquid one, the best for each specific cancer. And can we see here the liquid?
yeah. And now you can still get everything prepared.
Oh, it's not done yet. Okay, good. Okay. So this is this is history in the making, because not only that this technique has consisted has been alive for he has been working for all his life for 40 years, but it's so specific that nobody can do it. Nobody can do it. It has to have a strong, training in order to put the catheter until to the point. And then, as you see, it is not standard one. Sometimes, depending on the nature of the tumor, you have to have a CT scan. You have to have to determine the best point. So it is not a.
As you say, Dr. Florian. Dr. Florian? Dr. Florian? Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, we lost you, Dr. Florian. We lost your audio. Can you hear me? I opened the other microphone because we lost your audio. Can you hear me? Dr. Florian? Yes, I can hear you from the second camera, not from the first camera. I think you have a problem with the your phone. Can you hear me? Well, meanwhile, we continue here with the procedure. Let's watch it full screen. Meanwhile, this audio is open, so.
Mario.
Oh, hello, Dr. Florian. I can hear you
Okay,
now.
okay, good. Okay, I don't know
Okay,
what
very
happened.
good.
I just I'm gonna change the camera, back camera.
Okay. Very good.
Okay, good, excellent. Now you can see you can see the anti-cancer drug being injected. That's correct
Yes.
or no? This is the white one or no? Not yet. Not yet. Okay. So just
The dark area is the tumor?
the dark area here is a tumor here. This one.
Oh, there's the tumor.
Now the catheter has reached up to here because he found that this is the best position. So
Okay.
then this here you're gonna inject the like this.
Okay.
You're gonna inject. It's not started yet. No, it is going. You see, you can see in the other camera. He is injecting the.
He's injecting right now. We can see it
And
behind
we
the
can
other
see
camera.
it here also. He said that we
Yeah.
can see it here.
He's using a syringe, as we
Yeah,
mentioned.
exactly. But we do not know how can we see the liquid here?
He's not doing yet.
Not doing yet. Okay. So we will be able to see it here, correct?
Yeah.
Okay. So that's amazing.
Yeah, let's
This
take a
is-
look at the doctor.
Yeah. And this is angio.
Well, this technique is
Angiography.
called transcatheter arterial chemoembolization, or
Angiography.
TACE, right?
So-
TACE.
So as I understand, these live real-time images are given by angiographic, correct?
And usually, sometimes patients will be allergic to the chemo drugs. So the usually before when he just infuse
A little bit
and then
to see the effect.
just confirm whether the
To
patient is
continue
right
or not. Correct. Just a test to see
Yeah.
if there is a reaction.
Yes.
And if it is a reaction, you can change the
Yeah.
drug.
Yeah, we can change the drug, or we can just, use some drug to prevent the allergy.
Yes. So the real-time images are given by angiographic. And the basis of this is what? The basis is it's a radio. What it is? Angiographic.
Angiography.
It is
This is the set I told you is like IVRCT.
the set is IVRCP.
Plus the angiography.
Oh, okay.
Yeah.
Okay.
We call it IVRCT.
Okay. Oh, yeah. Now I understand. IVRCP.
And sometimes, in big hospitals, and they have CTs, they have angiography machines, but they don't have, they didn't compare CT with angiography. So, we are the biggest, the number one facility to have 3 IVRCTs, and that is the reason. Because usually, in other hospitals, they have CT and they have angiography, but they don't have, one CT plus angiography in one room.
Simultaneously in one room.
In one room.
What he's doing is okay.
We are the number one facility to have this, combination.
Dr. Florian.
Yes.
Angiography, if I'm not mistaken, it's used. X-rays are used in regular angiography, so that's why probably you're using this protection, this vest, right?
Correct. That's why I'm using the protection because it's.
So it's
because
like
of
X-ray, isn't it?
It's based on X-rays. I guess we're going to ask the doctor. Angiographic is based on X-rays, correct? It's an X-ray. It's a radio.
Yeah.
It's a radio.
Okay.
And the machine that gives the radio is the upper part. Which one gives this? Which one gives this real-time image? Which one creates the real-time image?
This one is the real time.
This is real-time.
Yeah.
This is plain. But which one gives that? This is the machine there on top?
There's no radiation and we cannot see the liquid. We cannot see the liquid. Only the Hori, he controls the radiation by his feet.
Okay,
Yeah.
okay.
There's a
There is a level here like this.
like this to control the radiation. Only the radiation.
But the machine of radiation is the one on top there. Okay.
Sorry.
Okay. So Mario,
Yes.
as I understand, this is a real-time image. This is replayed. Okay, the real-time image is here, and you can
I
see the
see.
catheter has reached here. Now the angiography is radio, it's X-ray based, correct? So and Dr. Hori has a level in his feet here, like this one, inside.
Oh, I
And
see.
he controls the level of radiation in order he can see the amount
It's
of
like
liquid
it's like
coming in.
a gas pedal,
Correct?
right?
Exactly. And
Okay.
this is real time. This is low radiation during the
Uh-huh.
entire procedure, correct?
Yeah.
And it could be higher if Dr. Hori wants to see the liquid, correct?
Very good. Very good.
So this is
So that thing on top of where he's got the light is where the radiation comes
based
from.
on.
based on
Just a moment, Maria. So the level of radiation, Cecilia is saying, is automatic. So there should be a criteria to control the radiation.
radiation. How, like 2 seconds, 1 second, and he can control the time.
All the time, the interval.
Yeah, when he made the radiation, and he just
Okay. So basically, the idea is the radiation angiography is automatic. So automatic in terms of you have the specific interval. So 5 times per a specific number of time per specific unit of time, number of radiation per specific interval of time. But if Dr. Hori needs more radiation for in a specific event, he kind of override this automatic and then with a level in his hand in his feet in order to if he wants a better view for specific like for example now that we are entering the cancer drug. Okay, thank you. Listen. Mario, are you there?
Yes,
Mario?
I am. I'm just paying attention here. I got my camera out so you could have both cameras simultaneously. And
Yes.
I mean, the star of the show is the doctor. So
Yeah.
So, Dr. Florian, you've been to some medical laboratories for the past
Yes.
years, and you've seen like robotics in medicine. You've seen like those I don't remember how you call it, but those dummies.
It's yes.
Like to
France.
reproduce human.
In France.
And this is technology, innovation, a lot of engineering together with medicine. And this is what we see: a lot of engineering, a lot of high-tech equipment. Yes, and medicine is not only looking inside the patient, but also all the technology that can improve.
Without the technology, modern medicine is zero. And what is amazing with Dr. Hori, so he is a doctor, he's a medical doctor, but his curiosity and his persistence, he has developed all by himself all this technique, taking all this, using all this, physical and chemical inventions that's developed for other purposes. He has adapted them, for example, radio, CT scan, everything else to develop this technique. So he is the best example. He's a scientist first, okay? He is also an inventor. He is a medical doctor, and at the same time, he's an artist.
Yes. Well, he's as a
Because
matter of fact, he's an interventional oncologist, right? And chief director
exactly
of
that's his title.
exactly. But I mean, he needs
Oncological.
a great deal of knowledge of angiology too. Not only oncology, but angiology too, right?
Correct. So
It's like you said, it's not
imagine
only one field of science, it's a lot of fields
yes,
together. That three, and that's
that's a
what SIPS
lot
is
of
about also,
360
right? A
degree. That's what
360
sepsis is
degree
about.
approach.
If you don't have all these knowledges about IT, about interpretation of radio, again, I tell you what we are used to. What is the standard practice? Okay, if somebody needs a radio, he goes to a different department, different clinic. If somebody needs a CT, he goes to a different department, different clinic. He goes to a SPET CT in another one. And the doctor that receives the original doctor receives only the report. They do not know how to interpret the CT scan, PET scan, etc. You have to be a specialist. So if the reports are wrong, the original doctors goes completely wrong procedure in treating cancer. Here, it's not the case. Here is the image guides the medicine. That's why it's called image, guided therapy. So it's the image. So Dr. Hori knows how to interpret all these images. He's a doctor, physical doctor. He's a scientist and inventor because he's developed all this technique, for the purpose of this technology. So you cannot find this, anywhere in the world. It's very, very. Every doctor.
Well, we lost Dr. Florian Kongoli. Dr. Florian, are you back? Dr. Florian, are you back? I think we have an audio issue again, Dr. Florian. Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, can you hear me? Dr. Florian, you have a connection issue with the microphone has a connection issue, Dr. Florian. Dr. Florian? Dr. Florian, I think the battery of your phone has. Dr. Florian? Dr. Florian, can you hear me? Dr. Florian? Well, I think with Dr. Florian. Well, we had a connection issue with Dr. Florian Kongoli. He's going to be back soon. Meanwhile, we've got Dr. Hori, who is performing here this transcatheter arterial chemoembolization, or TACE. Yes, this is a minimally invasive procedure that was originally used to treat liver tumors. Now it is widely applied to treat breast cancer, lung cancer, hepatic metastases, ovarian cancer, uterine fibroids, and other tumors. And I've got Dr. Florian Kongoli again here. Hello, Dr. Florian. I think we're experiencing. Can you hear me, Dr. Florian?
Yes, I hear you very well. I don't know what happened, but anyway, we are back.
I think there's a problem with your speaker, your phone. It's disconnecting. It's second time it disconnects. Battery, maybe?
Could be the other phone Bluetooth is off. It could be just I don't think it could be the signal.
But no problem.
We are back.
Yeah.
It's not important. So this is, everybody can film it and can transmit later. But this is real time. We'll have a little bit of glitches like this.
Exactly.
Not so important what we're experiencing in real time. So,
Oh no, this is
because
amazing.
if you
I'm really
edit, you can
impressed.
edit anything. But here is real. We'll have some glitches, Wi-Fi
It
and
happens.
data are not perfect
happens.
today. We're
Yeah.
not at 5G yet, so it's okay. But this is important, it's much more important. This is some
Don't worry.
small
This
glitches,
is something that I think, as we said, first time it's being shown live
Yes.
worldwide, and this is what Float Star Outreach is all about. What SIPS is all about, and
And by the way, Dr. Hori will present at SIPS this technology.
great.
He has a scientific presentation about this and all this experience. It will be amazing because it will be our program it's full. It's full. So we have many doctors in various different techniques, but this is something really exceptional.
Yeah, it is. Well, we're watching now Dr. Shinichi Hori from Osaka, Japan. Dr. Florian is, as we mentioned before, he's an interventional oncologist and chief director of the Institute for Image Guided Therapy in Osaka, where Dr. Florian is right now. And this is an amazing event we are experiencing today, because the first part of this broadcast, Dr. Florian went around and saw all the infrastructure that surrounds.
Just a moment,
Okay.
because
Go
Dr.
ahead,
Hori
Dr.
is here.
I did the treatment.
You can go here.
I did the treatment. Here is the tumor stain. So it represents the part of the tumor here. And I did the embolization.
Oh, you did it already?
Yes, I did the embolization after the infusion of anti-cancer drug.
Okay, you did it already.
Yes. So I will take the picture from now,
Uh-huh.
geography, and trees observe what has happened here.
Okay, so can we see the embolization, the blocked arteria?
Yeah.
Can we see it here? Okay, so very good information here.
Yes.
Embolic.
Yes. So what Dr. Dohori is, because it's a procedure like that, he cannot stop.
Okay.
He injected here. He injected the drug, chemotherapy. And at the end of the chemotherapy, he injected the embolization.
Embolic. Embolic.
Embolic liquid, which block the arterial blood to feed feeding the cancer. So this is the embolic liquid. This is also being developed by Professor Hori. So this is his invention. So basically, he is everywhere. He's a scientist and a doctor. He has again, what is this? Just to remind, is to block the arteria that eats the cancer. So what he did, he injected the chemotherapy, the right amount in the tumor, and then he injected this liquid to block the arteria
To
that
seal
eats the
it.
blood.
This liquid
To-
seals it.
Exactly. See, this is
Very
another invention of Dr. Hori. And now he's explaining us.
これ塩のさんが切れたとこ見せたいんで。Okay. Here is the angiography after the infusion, the embolization, and tumor stain has markedly reduced.
Already.
Yes.
Already.
Before that's the
This is interesting, Mario. Did you follow?
This is the before the treatment. You can see
The black.
dense black
Okay.
area, and this is the after the embolization. You can see the disappearance of the abnormal stain here.
Already in how long time? In about 5 minutes?
It's immediate.
In 5 minutes, it's immediate effect. It's amazing.
Wow.
It's
It's
amazing.
incredible.
effect.
The tumor disappeared. He killed the tumor.
And this is the real. Let's repeat it. We have to show again. Can we repeat it? Can you ask her to repeat? Who's gonna control this?
Okay, it's like wait.
So this is amazing. It's in 5 minutes, the tumor is almost gone. Mario, there? Mario?
Yes, I'm here. I'm here. I was
Okay,
just,
good. Okay.
yeah, I just got out of the broadcast in order to get only the two cameras together so that you could see him working and you could
Good.
show the
Excellent.
camera
Excellent.
and comment also.
Excellent. So we're going to show again. So basically,
Yeah, so I'm getting out of the broadcast. Okay, I'm here. Whenever you want to call me, just
okay.
call me.
Yeah. So he put the liquid, the chemotherapy locally. So recap from the beginning. First, you put the catheter. Inventional professor of Dr. Hori is a catheter. The technique of doing it, the technique, first, nobody, if you are not able to bring the catheter, if you're not able to bring the catheter there, you cannot do anything. So the first thing, he put the catheter very near, and then he took another CT scan to find out the morphology of the tumor and to find the right place where to put to send the catheter and put the chemotherapy locally. He put the chemotherapy locally with a normal syringe, and directly after that, he embolized the arteria. First of all, the CT scan also shows which one is the arteria that feeds the tumor. So exactly, and then he finds that arteria. He put the chemotherapy liquid there, and immediately after that, he inject this embolic liquid, which is his invention. I showed you the box, but this is the liquid. So, this is the material. Oh, this is the material.
Like we will load the
You go low.
load the
Yeah.
chemo
So this
drugs
is
inside.
correct. So this is the emballage. So he put it. He injected this one, and this blocks the entire criteria. He freezes the blood artery. There is no more blood going to the tumor anymore. And in 5 minutes after this, you see that the tumor has almost disappeared. Let's say 90%, 95% already. It's almost disappeared. So let's see it again if we can replay this before and after. But in 5 minutes, Mario, 5 minutes.
I'm impressed with this. Serious. I'm impressed. If you had told me this before the broadcast,
So
I
just a
wouldn't
moment,
have
two
believed
seconds,
it.
2 seconds. We're already playing this. So before, because this is very important. This is before. This is a tumor. And after?
Yeah, this one is after.
Which one is after? This one?
Yeah, after.
It's after. It has almost disappeared. It has almost disappeared. It's just only a faint area. Only a little bit of faint,
Incredible.
In 5 minutes.
No, it's incredible. It's impressive.
So, I mean, this type of tumors, they kill. This type of tumor, they kill. If they don't kill immediately.
Blood supply.
Sorry? Stop the blood supply, correct. I already mentioned, stop the blood supply to the tumor. So
Exactly.
imagine this kind of tumors.
But so fast. This is amazing.
They kill live. If they don't kill immediately, it will be years of chemotherapy and radiation and miserable life. And here, the cause of this, of life-threatening or miserable life, is destroyed in about 5 minutes. This is primary, tumor in a breast, in a woman. And how many women suffer today with this?
Incredible.
So, but this is how much you have to invest in the technology of Dr. Hori. He's invented this, and, many governments should invest money. People should invest money. This is amazing, and has to be passed, has to be more generalized, because this was an invention of only one doctor.
Yeah, this is amazing. This
the
is
doctor is not a usual doctor. It's a scientist. It is a physicist. It is a chemist. He's basically everything. He's basically everything.
and Dr.
He's
Florian,
basically accepts.
he has a characteristic that a real scientist has. He doesn't rest while he doesn't find the solution for his quests.
Which make him front, so we
Oh,
can see
really?
how his hand moves.
Sorry. Is this a bed? Oh, no. He changed. Mario, Cecilia told me that the camera there is not back. Now he's looking at. Then he corrected it. He's changing. No, until now he was looking at his hands. Mario, Cecilia said that the camera inside was backwards, not forward, but you changed it, correct?
No, it was okay. It was all the time like this.
No, but one moment, one of the professor told us, but it's okay. Now it's okay.
I don't know why it was all the time like this. What I'm doing is I'm switching between you and the doctor.
Yes.
And I'm getting myself out of the broadcast so that you can share only 2 cameras instead of 3.
Well, it's okay. So you can switch. But and now what they are doing here?
Now he's doing the embolization.
Oh, he's doing it. He didn't do it before.
So there's several arteries and
Oh, you are doing several arteries. Imagine.
the arteries feeding the cancer one by one.
Oh, that's what I asked him.
And remember last time the
Interesting.
he found one artery feeding the cancer like 90% of the
Of the feeding of the blood.
from the
Correct. Yeah.
from the artery.
Uh-huh.
There's only 10% left.
Okay,
There's also blood supply
from that.
to the cancer. So he will try to find another artery which is feed the cancer, the 10%.
Amazing.
Yeah.
You heard, Mario? Did you hear it?
Yes, loud and clear.
Mario?
Loud and clear.
Yeah, loud and clear. So this is exactly what I asked him. So he found the major vessel, blood vessel that feeds the cancer. It's 90% of the blood going through that one. But then it remains 10%. So see, he found what are the other blood arteries that feed this 10% blood. And then he's doing the 10% left. So basically he is blocking the blood feeding from all different type of vessels all around the tumor.
失礼します。息を吸って止めてください。
We will take the angiography after the treatment of this code.
楽にしてく
So
ださい。
can you come a little bit closer? Yeah.
Okay, this is the angiography after the treatment.
撮影します。息を吸って止めてください。
Now chemo stage gone.
So let's compare for the people.
楽にしてください。
So first and after.
This is after the treatment.
This is after the treatment, but let's start from the beginning, before the treatment.
Before the treatment. Here is the abnormal staining here. After the after. This is the therapy after the treatment. The tumor stain has markedly decreased.
Yes, it's about 90%, 95%.
Yeah. And this is very important point. We try to embolize only this part, not the feeding of big arteries.
Correct.
And if you occlude this big artery, it will cause the complication.
Correct. So you embolize only the
Tumors.
the thin artery is going to your right, right? So you embolize all of them, all the
All
feeding.
the feeding artery.
So you put a cutter in each of them.
Actually, it was possible to insert a catheter up to here, but you can see another very tiny artery is coming to the tumors. So actually, the diameter of this artery is smaller than a microcatheter. So it's theoretically impossible.
Oh, it is impossible.
So I
So
did the embolization from this branch, and then I put out the microcatheter up to here, and then I did the additional treatment from here. So all total of the tumor should be treated from this point.
okay, understand.
Now I try to insert a catheter to the another feeding artery. Yeah, it's much true.
So it's basically Mario. Is it the same?
It's
Higgs
incredible.
name? It's amazing.
It's amazing, totally amazing.
Yeah.
This guy's a genius. I mean, developing this. I mean, for the past days, it's incredible. You've been with some of the really greatest minds in the world. And this is what SIPS is about.
Yes.
Gathering some of the
Dr. Hori is
greatest
coming
minds
to
in the
SIPS.
world live.
He's coming. He has a plenary lecture in SIPS.
Yes.
So he is going to present this. This is, imagine, this is breast cancer, but this has started with liver cancer, now breast cancer, it's lung cancer. So basically, many type of cancer. So each cancer is different, it's separate, it's a specific technology because if I understand well, the vessels, the blood vessels are different. So you have to, in each case, is a different solution. So basically, numerous type of almost all the type of cancers. So should remain some new one that Professor Hori still is working, and he is describing this in SIPS. He has a plenary lecture, and this is
And
this is
Dr.
amazing.
Florian, the
Yes.
most impressive of all is that we started this broadcast almost an hour and 20 minutes ago. An hour and 20 minutes ago, the patient there had a tumor.
Exactly.
And we saw this, he killed this tumor. I mean,
Exactly.
and no surgery. This person is going home in 2 days.
No, he can stay. He can go. She can go home now, but this is just precaution.
But
She
I mean,
stays here
in 2
just as a
days, she's going
precaution.
to have
To
a
get
normal
home.
life as if she never had a tumor.
Exactly.
Wow.
90% already gone. 99, we can say 95. It's already gone.
And what happens? The body absorbs that, it will disappear.
Oh no, you can stay there as a. I don't know now. We can ask Dr. Hori, but you can stay there as an inactive thing. But who cares? It's not active
Well,
anymore.
this is amazing. This is incredible.
I would
No
ask
cuts,
what happens,
nothing.
but no cuts, nothing. That's why you wanted to see the nurses. There is no. The nurses are
No, this
the
is
TV
incredible.
screens.
Yeah.
The nurses are the TV screens. He has
But
5
you
TV
see,
screens.
the machine, the artificial intelligence doesn't substitute totally the human
No.
being, because he
No,
needs
no.
to be there.
No, exactly.
Yes.
It's at the service of humans.
At the service
that's
of
what-
humans. That's it.
That's what he has done. He has adopted all this achievement of science in physics, in radiology, in any field of science. He has adapted to his own methodology and treatment. So they are serving him. So you see, he has. Just to make you a joke. He has 6 nurses working with him. Do you know what they are? They are 6 TV screens. Mario? Are you there? Mario? I don't hear you.
Can you hear me?
Now I hear you, yes.
Yeah, my microphone was off. Sorry.
So
This is impressive.
no, but he's working there with 6 nurses. 6 nurses. Okay, but do you know there are 6 TV screens.
Yeah,
6
it's
TV
incredible.
screens. You didn't follow live? You can follow live. So now he is blocking the arterias. He's blocking the arterias of the small arterias, because basically, as I said, he embolized. Embolize is a medical term. Basically, it's blockage. You block the arteria that feed with blood the tumor. But there's several arterias that feed the tumor.
It
You block the one that
suffocates
was
the
the
tumor.
major one
It
and block
asphyxiates
the
the
small
tumor.
ones.
息を止めてください。
Dr. Florian? It
Yes, I'm here.
asphyxiates the tumor.
Exactly. So that's in 5 minutes, a person with a tumor in the breast becomes a person with 95% tumor free in 5 minutes.
Well, this is impressive. This is
And you can
impressive.
show here.
And
we
the
show-
patient is awake, right? The patient is talking
And the
to you.
patient is awake. It's only local anesthesia for the
It's
puncture.
incredible.
That's all. So yes.
When I get succeed to insert a catheter to the another feeding artery,
Uh-huh.
it goes into the lateral part of the tumor. So I'm quite sure then I'll try to start the treatment from here.
Correct. So you're going to put another chemotherapy from there,
Yes.
and then you're going to embolize.
Yeah. And 80% of the drug has already infused from the main
The main artery. This
So-
is 10% or something.
20%.
20%
Just
left.
20% of the
Okay.
cancer drug will be infused from here. And then after I'll do the embolization.
Embolization of this part only. This part here. Did you understand, Mario? It's very, very clear.
Yeah.
Yes,
And
yes,
this
totally.
is more staining is lymph node metastasis. And another part of the enhancement is the part of the tumor, the lateral part of the main tumor. So we can treat both usually.
Simultaneously.
Yes.
Perfect. Perfect. So it's exactly what we described. So in the
Okay.
beginning, he blocked the main arteria that was feeding the tumor. So first of all, he has to find the main arteria, okay, with angiography, and then he uses the main arteria that feed 80% of the blood to inject the chemotherapy locally. And then immediately after that, he embolizes, block this arteria in order not anymore blood and oxygen going to the tumor. However, this is 80% of the feeding of the tumor. So now he found out that another arteria that feeds the remaining 20%. And this 20% was this one here. This is replaying. If you can show, here, this one. So this is the secondary arteria. And here there are 2 black dots. These black dots are metastases. But it is the same blood vessel that feeds 2 metastases. So then now he was able to put the catheter until here. It will inject the chemotherapy liquid or whatever drug killing liquid, and after that it will embolize. What do I mean embolize? It will block the whole this artery. So basically the tumor already gone 90%, because we saw before and after in 5 minutes. Now it will have no more lifeline. There is no more blood coming to it, and it will be surrounded by chemotherapy locally. So it's almost dead.
Yeah, impressive.
This is what I speak about.
This is really amazing, Dr. Florian.
And that's why this technique can be used also for metastasis, not only correct? Not only from primary breast cancer, but also from metastasis. Here it is an example. There are 2 small metastases here, 2 black dots. But it is only one blood arteria feeding them. So with this you can very well use this. And by the way, just I found out something that I didn't notice before. These are the nurses of Dr. Hori. This is the same nurses that are there, but they are in two places. These are 6 nurses, 7. 1, 2, 3, 4, 5, 6, 7 nurses.
Yeah, incredible.
This is the same screen that Dr. Hori looks there.
Oh, yeah, for
So
sure.
this is the same one, just I noticed now, and I forgot. I didn't notice this before. And this is what he's doing. Look, the same thing he mentioned here when he came here.
Yeah.
That's the same screen there.
Yeah, the image is not so clear because I think it's too bright.
Probably because it's let me see. If you can
Maybe if you get closer.
But these are the nurses of Dr. Hori.
Ah, okay. Now I think we can see a little better. Not, but we can have an idea of what it is.
Yeah,
It's
so
almost
this is
the screen
this
you
is the
saw
arteria.
on the big one.
This is
Yeah.
this is here. This is the arteria that we showed there.
Okay.
This is what he is doing right now. He
The
is
dark
injecting
line is
liquid
the
through
artery,
exactly
right?
the arteria where the catheter is there. He's putting the drug
catheter.
cancer the liquid and block the entire arteria that's there.
I see.
So these are his nurses, very good nurses. Yeah, they are very, very good nurses. They are
Yes.
amazing nurses.
Have this the 3D construction of the blood vessel.
Okay.
Yeah, and usually we do the CT before the procedure, and so we can our radiation grapher, and they will just help us to build a 3D blood vessel.
Yeah. So this is so you are using to make a 3D. You are using angiography.
No, the CT there.
scan.
Yeah, we showed you this morning that
Okay.
patient clinic.
So the CT scan creates a 3D.
Yeah,
3D.
and we can help our doctor find the
And this is the tumor.
yeah.
So this is a 3D simulation of the blood arteries.
Yeah, and how they goes, and because we have to insert the catheter, and we should know how the what is the direction of the blood vessel.
Right.
Just like this way or go there.
So the catheter goes through here, correct?
Yeah, and this is the blood vessel feeding the cancer.
The cancer.
Yeah.
And the secondary one is here. This is the main one.
どの3つしたいな。どっち治療したの？
これと
This one.
Oh, this is the one here. This is fitting.
Yeah, this one.
This one
And
fits.
3, yeah.
One,
Yeah, 3.
one.
2. And
This one, but
Yeah.
it doesn't fit. It doesn't come here. Ah, it comes here.
これは来てないですねって。
全体からもかしたね。
Can see now here. Here, and we inject here, and it comes here.
Oh, okay,
Yeah.
okay. So the catheter doesn't go up to here.
Yeah.
Catheter stays here.
来てるかな？ここ来てる？この血管にも来てるんだ。
この血管は最初に治療した血管です。
うん。ここもちょっと同注したの。
これまた
全体的に。
Just there is sometimes there were some small vessels we cannot see, and so he did it here, just in case there is some small,
Oh, okay. Understand.
just totally from that
Yeah,
side.
understand. This one here corresponds with which one here? This one.
前回の
3D です。
治療してない。3D でここ
It's this one.
これ。
that one. This one.
Oh, okay.
Yeah,
This,
yeah.
this one has to go
Yeah,
here.
because they have the certain curve. The curve
Same,
is
same,
yeah.
same.
So this really helped. This 3D extraction really helped when Dr. Hori did the procedure. Yeah, because you can judge which one is fitting.
So the 3D is given by CT scan, correct?
Yeah, it's me today.
So this is and this one. This is the main. This one. Which one is this one?
It's full of. Oh my God.
と、
Oh, this is the one. Okay. Okay.
Here.
Okay. So basically, Mario, you're there. Mario,
Yes, yes, go ahead.
you hear me? Yeah.
Yes, I
So
hear you.
basically, Dr. Hori is a specialist in the labyrinth of all blood vessels.
Okay.
You know. This is
That's why I
another-
said, besides
this is
being an
another-
oncologist, he needs to be a great angiologist also.
No, but yes, he is.
I mean, as you said, it's we divided science in fields, but it's one science only, right?
Exactly. They hear you see it here. It's
Nature.
only one side.
Yeah.
Only one side.
It's amazing.
Yeah.
It's the last.
It's amazing.
Oh, okay, they're doing another one, correct?
Last one.
Oh, this is the last one. Okay. Here. Oh, this is the new one. Okay. Okay.
He's injecting.
失礼します。
Okay, this is the
してください。
angiography before treatment. You can see the abnormal stain here and here. So I did the treatment, already did the treatment. And then we will do the angiography to confirm.
To see the change.
Yes.
That will be very interesting. Did you understand, Mario? As
Not
we did
exactly.
before.
What did he say?
Well, you know, we did with the main arteria, he did an angiography. And then we
Okay.
compared before and after.
Okay.
This was for the main arteria. Now he did the treatment for the secondary arteria.
そのまま息を
He
止め
put
てくだ
the
さい。
liquid in it, chemotherapy. He blocked the vessels, and now they are doing a new angiographics in order to compare before and after. Before we know already there are black dots here. This is before.
Okay.
There are black dots of tumor.
楽にしてください。
Okay.
Now the new angiographic we're gonna see the difference.
Yeah. The abnormal stain has disappeared. Here there was the abnormal stain here, and the other one is here, but both of the lesions have disappeared.
Disappear. So you see, you remember. Let's go back and before
Yes.
and after.
Yes.
Before the black dots. The black dots are the
yes.
okay. Now after.
Okay, this is the time to stop.
Stop. Good. So it is completed.
Yeah.
Just-
Patient with doesn't complain of pain.
Oh, exactly. No pain, no reaction,
Yeah.
no side effect. Perfect. So just to go here, you see again because it's important. This is the result. You know, in real time. Okay. So before.
Yes. I'm going to get out again so I can show both cameras. Okay.
Here, these are the black dots. These are the tumors. I mean these are the tumors. These are before and metastases. Now this is after. This is after. Do you see the black? Do you see any more of the black?
Dr. Florian, it's a little too bright. Maybe if you move
too
the
bright.
camera a little.
Okay, I'm gonna do it. I try to do it. Okay, we're gonna do it again. Put it
Much
in the
better.
main screen.
No, only the last part I could see before.
Okay, so can you repeat
It's-
a little bit before? Yeah, before. before you see the black tumors here, black dots.
Yes, yes.
These are the tumors, the metastases. And this
Two
is
black
after.
dots.
And after, these are black dots still. This is before. Okay? Now we're going to go after.
Wow, incredible. Nothing.
Nothing.
Yeah, no, I'm impressed. Serious.
This is 5 minutes.
Yeah,
Because
it's incredible.
you attack exactly at the source. Exactly at the source.
We're talking
You
about
don't make
this
your
would be
life
equivalent to maybe 2 years,
horrible
maybe
with a lot
6
of
months chemotherapy.
6 months chemotherapy is minimum. They continue over
Minimum,
years.
minimum.
They change one medication to the other. They change one chemotherapy to the other. All of them have side effects. They can burn you into hell. Your life, your
And
quality
as you
life.
said, the patient has no pain. The patient was awake all the time.
Patient is awake all the time. No pain, no reaction. I mean, in 2 hours, basically, she is tumor free, cancer free. She stays only
Incredible.
she stays only 2
And she will
days here
recover
just
2
as a
days
prevention,
looking at the ocean.
just to make sure that everything is fine.
Yeah, looking at the ocean.
And they shut down the blood supply, not cancer.
Yeah, sure. Okay, I understand. Okay, so Cecilia is mentioning one very important point. So, when I say cancer free, it's not that cancer, by shutting down the blood supply. So the cancer is there, but it's dead, correct?
They're
It's not active anymore. So it is still there, but it's not harmful.
so
Yeah.
just temporarily. Sometimes when as time passes and the blood supply, sometimes they will come again.
Yes, but then you have to
Okay.
do it again.
Yeah.
So I mean, but this is so it is there. So in case
Okay.
a new
Dr. Florian, we had an issue. There you are. Dr. Florian, a problem with your audio again? Dr. Florian, we have an issue with your audio? We lost Dr. Florian. We lost the connection with Dr. Florian Kongoli. But we continue with Dr. Hori. He is at the final stage of the procedure. As we've mentioned before. Well, here's Dr. Florian again. Hello, Dr. Florian. Welcome back.
Yeah, we have. I think it's a Wi-Fi interruption, but it's
Probably.
Okay, yes. Just a moment, because Dr. Hall just came here.
Look, this is the microcatheter I used for her.
This is the microcatheter.
Yeah.
Wow, incredible.
So the actual diameter is less
It
than
looks like
1 millimeter.
So it's less than 1 millimeter. 0.7 millimeters, I don't think.
Yeah, well, 0.7 millimeter.
0.7 millimeter is this one.
So we can manipulate the
Incredible.
microcatheter and we can turn this and try to select individual artery. Turning this microcatheter.
It's amazing. So you can control this.
Yeah.
Dr. Florian.
And this is so soft. It doesn't damage any arteria.
Right.
Look, so it is very soft. And here you can inject the embolization. I mean the drug from here.
Yes.
And the embolization liquid.
Yes. Here is the very tiny holes. So we can kind of drugs and then the materials in this hole.
Amazing. So this is what kind of materials is that?
How the embolic material is the superabsorbent polymer microsphere.
It's a polymer.
Embolic material.
It's a polymer.
Yes.
Where did you find out
Florian, it looks
about
like a
this
fishing
polymer?
line.
It takes a long time.
I know, but it is so, there are so many polymers. So how to come to the one you want to
We investigate many kind of substance, like the rubber and some kind of plastic ball, or something like that. But finally, I found that the superabsorbent polymer is the best for the embolic material.
Yeah.
And it can absorb the many kind of the drugs and the release.
So you worked on yourself on this.
Yeah.
You tried each of the polymers.
Yes.
So you have a scientist here. You see, scientist before being a doctor. Well, again, you cannot really choose. It's all of them.
Yeah.
So and the material scientist, by the way, this is material scientist.
So
Yes,
you
I
see,
think so.
you've got many
Okay.
fields of medicine.
I'll
You've got
put
materials.
the pressure on the puncture point. It will take 5 minutes.
Correct. So the pressure is to do what?
To on the puncture point of the artery
In order to
to stop the bleeding.
to stop the
But it will take 5 minutes.
correct.
Yeah,
correct.
exactly.
So
Yes.
during the catheter, it's still you have bleeding all the time.
No, not at all.
Oh, okay, just
No bleeding from that.
just because you're going to remove it. Okay, correct.
It will only take 5 minutes to stop the blood flow.
So the a surgery that takes only 5 minutes to stop the blood flow,
Yeah.
which is not a surgery at all, So this is
It's incredible. It's
Yeah.
incredible.
this is
I'm impressed.
well, and this you have to show live, because if you don't show live, you can do editing anything, but here it is real time. So we are,
Well,
and as you
it's,
see here, this is new for me. I didn't know in 5 minutes you cannot see, but but it takes some time for the cancer to die, but we do not see it on the correct.
Cut the blood supply.
Because we cut the blood supply makes it invisible.
Yeah, make the cancer hungry, just hungry.
Okay.
Yeah, 'cause the nutrition.
It's something
And that's-
magnificent here. Sorry.
To make the cancer die.
It's
and
I'm
to-
impressed.
To repeat this procedure again and again, and so we can probably can make the cancer die.
Yeah. But so you normally it is 1 time, 2 times.
This procedure probably is once a month.
Once a month.
Yeah. Just in the beginning, in the beginning of the treatment, just once a month.
Okay.
Yeah, to control the tumor.
Yeah. But if now we don't see it, in case we see it again. But if we don't see it, you don't need.
However, after 1 month, probably, the cancer they were strong, and they will try to leave, and they will create new artery.
Artery, blood vessels.
Yeah.
You can show her when she speaks. No, it's okay. Yeah. So this is
Yeah,
that's finalized.
yeah, that camera is off already. I mean, it's not focusing
Yeah, because they
anywhere.
put the scan, they rotated the big screen,
Yeah, no
and then they
problem.
blocked our camera.
No problem.
But
see
we
the
can
back
put
of
it
the screen.
here, and so
Anyway, this was a very amazing broadcast we've had, Dr. Florian.
yeah.
And we're getting to
this
the
is
end
really
of it.
amazing.
It's really, really impressive how, as you said, when you put art and science together, 1 + 1 can be.
Exactly, that is the case. Here it is. We have to figure out art plus science makes 1 + 1 makes what, 20?
Well, I don't know, whatever you want.
Yeah, whatever.
Because
you
I
want.
mean,
Yeah, that's-
there you have art, because you have experiments, like you have materials, you have anatomy, you have angiology, you have oncology, you have Well, it's a procedure, but very invasive. But it's almost a microsurgery because you have to stop bleeding. So, I mean, it is amazing. As you said, this is the secret of SIPS because everything is connected. You cannot say
And
this was only oncology. This was engineering. This was environment, the protection. This was sustainability. This was
exactly.
economic development. This was academia. This was everything. I mean,
Yes.
we haven't talked about the sustainability framework.
Yeah.
I would like you
Yeah.
to finish talking about this, and I'm
Yeah.
going to put it on
Yeah.
because everything
Yeah.
is connected, and this is what I'm
Yes.
impressed with. Seriously.
Yeah, Dr. Hori, he will present scientifically. This is, all the principles we discussed, how it works, etc., etc. But we touched almost all of them. So, this scientific presentation will be at SIPS. It will be at SIPS with a plenary lecture, and this will be the science of this new technology. And then, if you have this technology, if you have many like Dr. Hori, imagine how many lives you save and how many horrible lives you, make normal life because of the months and years of chemotherapy, and how many, and how many broken links between loved members when the chemotherapy could kill you. Sometimes the cancer doesn't kill you, but if the chemotherapy kills you.
Yeah.
So this is the major thing in the quality of life. That's a sustainability. It's a environmental protection, economic development, and quality of social of society, of human life. So here, Dr. Hori is a star. Here, Dr. Hori is a star.
Yeah, I'm placing in the screen
it is
the
improving the
framework.
quality of life. You're saving life, improving the quality of life, and this is amazing. And this how you do this. Science technology is the first one. Can there be a better example than this science and technology that Dr. Hori applied himself to develop this technology? He himself, everything comes from his contribution, and this is amazing. So you start with science and technology, then you manage it properly, and then you educate new people to be like Dr. Hori. So and then that's it. Here we are in one of the best sustainable clinic in terms of the results, where science has a major goal. And that's it. We wait for the Dr. Hori to finish and say goodbye to all of us. He said,
and so before he comes, let me play a quick movie here about SIPS because this and much more we're going to see from the 27th
which
of
movie?
November.
Which movie you can say it? I suggest why doctors participate.
I don't have this one here. I think
you have it.
Yeah.
Yes, Dr.
Oh,
Hori
there he is.
Yes. So it has been amazing, really.
Thank you.
So this was broadcasted live, but you can see it after the same link. We're gonna send the link. But this is a different thing. We have to probably have a 20 minutes interview, but this is amazing. Science, medicine, physics, chemistry. You have it all. What's the secret? How you do it?
Yes, when I was graduated from university school, I decided to specialize in interventional oncology.
Okay.
So at that time, it was almost 30 years ago, and there was no sophisticated machine, and catheter was very primitive, and we don't have any good material. So I decided to do the basic study, research study in the university. It took us now 14 years. Finally, I completed the procedures.
Amazing. But this will leave it for another interview for artists of science, because this is artists of science. So, but here we are at the end of this amazing experience. So a revolutionary technique, killing and treating cancer, and at the same time broadcasting live. Broadcasting live.
This was fantastic. What
Dr.
an
Hori,
experience.
Dr. Hori is being held by 7 nurses, which on 7 screens.
Right. Right.
So the nurses are 7 screens there. So you imagine what's the difference. There is no surgery, no invasive surgery. There is no side effects. There is no miserable life of years of chemotherapy. There is, the risk of being killed by chemotherapy instead of the cancer. So here in 2 hours, you get almost get out with almost dead cancer, correct?
Yes.
And how long it takes to be completely dead because we don't see it anymore? How long it takes to be completely dead, the tumor?
It depends on the tumors, but it will take 1 week or 2 weeks.
2 weeks, okay. So in 2 weeks, you are
No, it's
done.
impressive.
This is
I'm
so
really
imagine how
impressed.
many people are suffering right now with all this, with doctors have given up. They've changed chemotherapy after chemotherapy and they have
Yeah.
no solution. And here,
No,
this-
this is
here is the
incredible, Dr.
solution.
Florian. This is incredible.
Yeah.
Dr.
and
Florian.
people should know.
Yeah,
Now, this is a lifetime contribution. This is really the star here.
I would like you
And
to ask
now
the
we
doctor.
are treating the breast tumors and liver metastases and lung cancer and many kind of the very common cancers.
Yeah.
So we are treating a lot of patients using the similar technique.
So you know, somebody asked, is any cancer that is not treated yet?
Pardon me?
One of the viewers asked, is any cancer that is not cannot
Prostate
be treated
cancer
with this technique?
specifically.
Prostate cancer, for example.
For example, it is very difficult to treat the brain tumor.
Brain tumor. What about prostate cancer? He's asking.
Prostate cancer is theoretically possible.
It's possible, but it needs some research.
Yeah, we need another experience for the prostate cancer, and we have to develop the special technique to insert the
To
catheter.
insert the catheter there.
into the prostate.
So that's the key, inserting the catheter. As long as you do that, everything is after that.
Oh, I see.
straightforward.
Yeah.
Yeah, interesting. Makes sense.
Perfect. It's amazing. So we finalize here. with
Well, I
Dr.
just have
Hori
one
to start.
question
Yes.
for the
Okay,
doctor.
here's another question.
Yeah.
Yeah, please.
How it was developing, because this involved materials, this involved engineering,
Yes. Materials,
computing.
engineering,
I mean,
computing.
There's so many branches. How it was to be multitask, to be like involving so many disciplines in the development of this technique.
Yeah, that's he already mentioned a little bit. He's asking, you are multitask, engineering, radiography, angiographical, CT scan, material,
Oncology,
oncology, interventionist. So, what's how you became so multitasking? He's asking.
It was
But this is Artist of Science question. Will be an interview after that.
yes. 20 years ago, I established this clinic
Yeah.
only for the interventional oncology. At that time, it was not so popular, and nobody knows what is the transarterial treatment for the cancer. So I had many things to solve.
So you did it yourself.
Yes. So it took 20 years. Finally, we are very, very convinced that this treatment is one of the best treatments for the cancer, cancer patients.
So there is a solution. No,
yes.
nobody can be helpless now. There is
Yeah.
help here.
Well,
But I want to
sorry.
make it very, very common treatment
Correct.
worldwide.
That I mentioned already. So this will
Yes.
be many Dr. Horis like this, and people
No,
will feel
I'm really
much,
impressed.
much, optimistic. No, they'll not fear anymore cancer because you with a small catheter you can kill a cancer.
No,
This
this
big,
is incredible.
this big mammoth that has terrorized the world can be killed with a catheter of 0.7 millimeters. Yes. And that's it. You know, what can I say more?
Well, the only thing we can
Thank you
say,
very much.
thank you very much, doctor.
He's asking, thank you very, very much.
Congratulations.
And congratulations. But
And just
really
tell him I
amazing.
want to see him in Stockholm very soon.
Yes, yes. And he's saying they are looking forward to hear you in Stockholm in a scientific side. Perfect. We can shake your hand. Thank you very much. Thank you.
Thank you. Thank you.
We appreciate it.
Okay,
So,
Dr.
that's
Florian,
it.
I think that's it.
It was the longest one we did, but it is worthwhile.
Oh, it was fantastic. And before we finish, why medical doctors participate at SIPS? And before showing this video, we'd like to say goodbye. Thank you for this opportunity. It was really unique. Dr. Florian?
Yes, I'm here.
Okay, you can say goodbye because right after the video.
So goodbye from Osaka, Japan, where in IGT clinic, where real science is a service of patient. The real science is service of patient. So if you feel helpless because of this mammoth that have terrorized your life for so long, when the doctors tell you, we're going to keep you on, with medication alive as long as we can. Forget it. That's not the case anymore. That's here. The solution is here.
Very good.
Image guided therapy. Dr. Hori, 45 years all his life, has dedicated to this, and he deserves to be a star.
Exactly. Well, I'd like to thank everybody for watching. I'm Martin Yanez. I'm broadcasting from Cabo Frio, Brazil. Dr. Florian Kongoli is in Osaka. And I would like to suggest you to subscribe to the channels. This is a joint broadcast between TV Onda Azul and Flows and Star Reach. So subscribe to the channels. Just leave a like. Just hit the thumbs up button and also the bell button to be notified when we have a next broadcast, and leave a comment. This will always help us to become more relevant for the algorithm, for YouTube's algorithm. And I would like to invite everybody to be in Thailand, in Phuket, from the 27th of November to the 1st of December, where some of the greatest minds in the world will be there to talk about sustainability through science and technology, because this is where SIPS, Sustainable Industrial Processing Summit, and exhibition will take place. And talking about this, let's see why medical doctors should be at SIPS. I'm Martin Yanez from Cabo Frio, Brazil. Thank you very much. See you next time. Bye-bye.
Flogan meetings are unique in the sense that they combine science, engineering, and fun.
Here they talk science, they talk engineering, they talk technology.
And indeed the very relations between the science, the engineers and the politicians. That is a framework which is absolutely essential.
It's very important for me to understand how interact, let's say, the science with the sustainability and the social responsibility.
I really enjoy going to meetings when there are people from various backgrounds and disciplines, because I learn a lot and I make a lot of new friends, and sometimes we end up working together and collaborating. And when you bring people together with different backgrounds and different interests, you create new technology and directions, and that's very important. You mix businessmen with scientists, you have biotechnology. I'm in favor of that. I think that's very, very important.
I'm really happy to hear, because many scientists, especially Professor Feridun, he is still really interesting to take care of the patients or the disease by using the antioxidant. Professor Christian Motore, he is doing the basic electrochemical research on oxidative stress. That helps us a lot to develop next step for the treatment with antioxidant.
Well, Dr. Florian, first of all, thank you very much for this invitation. Because in fact, I had a lot of fun watching marvelous presentation about different subjects. Some of the subjects even they don't belong from my field of interest. I found implantation of medical devices. How technology, how is the status quo right now of the medical implants and devices? That was a fantastic panel.
It's a huge conference including many areas, chemical, physics, medical, environmental, many things. It's an amazing conference. I'm really